There it is. All right. So YouTube will go through it here in a minute. All right, so history and background. What does sports medicine mean, and who makes up the sports medicine team? Um, what is your athletic trainer? It would be nice to have had this finished up behind it. Sports medicine is a subsection of medicine that partakes into those who are actively living an active lifestyle. Now, a pediatric person is going to take care of kids. A geriatric is going to take care of old people. An oncologist takes care of cancer patients. Sports medicine is taking care of those who live an active lifestyle. You don't necessarily have to be an athlete in order to see a sports medicine type physician. Maybe you're a recreational runner. I don't see how running and recreation go together in my mind, but some people do. So those people might end up with some shin splints, plantar fasciitis, hip problems, etc. So they would see their sports medicine, who is used to seeing those athletes or those people in the population who actually play or are physically active. The role of athletic trainers or athletic training. All right. So when people say, well, what's an athletic trainer? I say, coaches get kids hurt. We try and keep them well. Pretty much basic. It's the prevention, the evaluation, and rehab of athletic injuries. So we want to prevent her from hurting her shoulder, so we're going to break her skis. All right? Once she runs into someone and we look and we see a shoulder all dripped down, then we know she's got a dislocated shoulder. All right? If we have the skills and have done it before, we would reduce it. And then it's time to rehab it and get her back on to the field. All of this is done under an umbrella of your orthopedic or team physician called delegation of authority. Okay? So we'll go through roles and personal qualities here after a while. The history of the NAT or athletic training in 1950. Okay? I know you guys think that's so long ago. It's really not. It's only 66 years. In 1950, a group of athletic trainers got together and they started the National Athletic Trainers Association. The very first meeting was in Kansas City. Write it down. The very first meeting was in Kansas City. A guy named Bobby Gunn was the very first president of the NATA. So this is how this works. There's the whole nation, all 50 states. But at that time, there were only how many states? Yeah. So, in 19, all the states. Now, what they did is they had the athletic trainers, they got together and made a large group. Now, out of that large group, there's 10 smaller groups for each region. The way they decided to do that is, you've heard of the SEC, Southeast Conference? You hear, now you don't hear of it now because it's defunct, but the Southwest Conference. You heard of the Big Ten Conference. There was also another conference called the Big Eight. Now these are college conferences. All right. There was the PAC, the Pacific Coast Conference, the Mountain West. I can't even remember what they were called there. So all of these trainers that would see each other. So if you worked at Texas and I worked at A&M, heavens Betsy, but we would see each other several times a year just through contests between each other. So, football game, baseball game, basketball game. And so the NATA put them together by conferences, and they called them districts. So they went from District 1 through District 10. All right? So you have the NATA, which is the father or the big ship. Now, SWATA, the Southwest Athletic Trainers Association, it only has 2 states. and that is Texas and Arkansas. And the reason why is that when it was created, the NATA was created, it was the Southwest Conference. And those schools that were in the Southwest Conference for football, basketball, and baseball was the University of Arkansas, TCU, SMU, Baylor, Texas, Texas Tech, University of Houston, Texas A&M. All right, I think that's all there was. So as you can see, they were all in Texas except for that one in Arkansas. So they just put those two together. Now District 9, why they call it 9, it's right next door. I don't know. Goes from Louisiana all the way to Florida and then up into Georgia because those were the Southeast Conference. That's how they decided to make their smaller district. All right. So AATA would be the Arkansas Athletic Trainers Association. So it gets even more specific. Now those smaller ones really are somewhere around 20 years old to 10 years old. All right. The one for Texas is TSATA. Can you think of what that might mean? Texas State Athletic Trainers Association. So you can go to the website tsata.org and find out hopefully information that pertains only to Texas. Now, in 1971, not on there. In 1971, there was one state that had licensure, meaning you have to have a license, just as if you were a doctor or a nurse or a lawyer, etc., to be an athletic trainer. Can you imagine what was that first state in the country to make sure that athletic trainers were competent enough to take care of their people? Huh? What state? What state would be the first? You are right. Texas was first in 1971. And even today, Texas still has a licensure process. Now, the NATA, the big boy, they have a certification process. So Texas said our licensure is as old or older than what your test is for your certification. You only have to be licensed in Texas. You don't have to be certified. But in some states, you have to be certified to get the license. Not in Texas. You can get a license and you'll be fine. How do you get a license? We'll get into that. So here's the umbrella of sports medicine. This looks like a great question where we go, which one's human performance? Which one's under injury prevention and management? So your human performance is your exercise physiology, your biomechanics, your psychology, nutrition, and massage. On the other side, practices medicine under, of course, the team physician is the only one who practices medicine. Athletic trainers do not practice medicine. If we were to practice medicine, we would need to have a medical license. All right? Sports, physical therapy, and then athletic training. So, I don't know why it's, but your human performance, you need to know about the physiology of how, physiology is the study, we already went over this, right? Remember our vocabulary words? Physiology is the study of functions of the body. So as soon as she gets hurt, as soon as she sprains her ankle, instantaneously there's reactions to that, and that's part of physiology of what happens. As soon as she starts to run, her body starts to change. We need to understand what happens when the body starts to exercise. So, biomechanics. While she's running, she looks like a duck out of water. We need to know why she looks like a duck out of water instead of a person on land. So we'll use biomechanics to look at that to make sure that she's running in a proper way that facilitates good mechanics and helps her physically perform. Obviously, you need to know about sports psychology because if you are bothered by things. You get the mental block. You can't make the free throw. You're having problems at home. It all starts here. If you can't get out of here to the rest of your body, you're not going to be very successful. Nutrition, if you're just going and eating chicken nuggets and drinking a milkshake for every meal, you're not feeding the body the right fuel that it needs in order to take care of the demands that an athlete is going to put on it. Massage, I'm first. Good. All right, athletic trainers are healthcare professionals who collaborate with physicians. The services provided by an athletic trainer are prevention, care, evaluation, therapeutic intervention, and rehab of athletic injuries and medical conditions. Athletic training is recognized by the American Medical Association as a healthcare profession. All right, here's some fun roles, and it's going to go into that next one. So your roles of responsibility, prevention of athletic injury. You need to recognize, evaluate, and make an assessment. All right? So it doesn't say you diagnose. You evaluate, you recognize the person's hurt, you evaluate, and then you make an assessment. That assessment then gets passed to the physician with the athlete, and they will confirm and then make a diagnosis. Or they will say, I think you got this one wrong, and make another diagnosis. We are pretty proud about making sure that we try and get it right so that we don't look like a bunch of dummies when it comes down to we send a kid to the doctor and we say, oh, he sprained an ankle. No, he didn't sprain an ankle. He tore the the ligament of the common groove for the peroneal tendon. They're right next to each other. They might mask one thing over the other, but if you don't know one from the other, then maybe you shouldn't have passed your test. But immediate care of injury. As soon as that injury occurs, we are the first people who are going to see that injury. So I had a kid, and he was blocking at Kingsville, and he went in to block, and a kid got hit. All right, so I get to the field, I see him immediately, and I pull on him. Oh gosh, he's torn his MCL. I said, they told me never to do that. That if once you see an MCL, you're probably going to see others. So just stop there. He's not going to play anymore. But I did. This is the one time I did, and so I did a Lockman's test, and his ACL was gone also. Okay. In less than 12 hours from the time that the injury occurred to the time he saw the doctor on a Saturday morning clinic, the swelling in the joint covered up his test for the Lockman. It didn't look as if he tore his ACL. So the doctor was sitting there and arguing. He's saying, he didn't have an ACL tear. I said, I promise you he does. I saw it 14 seconds after it happened. You're seeing it 14 hours after it happened. I promise you it's torn. Finally, after months of waiting for insurance to take care of their business, a couple of months later, he gets an MRI. What's he got? He's got a torn ACL. So it's important that you, as far as your immediate care of the injury, you're the first one there. You need to know what you're doing and take note of everything that you see. All right, so we get him back to the doctor. It's time to treat him and rehab and recondition. If we rehab the athlete only for that sprained ankle, but we didn't recondition to where they can run again and have stamina and not wear out, we're going to go back in a nice little circle, and we're going to have to see another injury because now they're tired. Healthcare administration, including your physicals, your insurance claim forms, taking care of all of that fun stuff is part of your healthcare administration. And then professional development and responsibility. Here in a week or so, I think it's in 2 weeks, I possibly could be gone on a Friday. And the following Friday, she could possibly be gone because we're going to learn new materials to bring back to our school. The stuff that we're learning is cutting edge. Now, what kind of qualities do you need to have? Remember two-a-days? Anybody in here remember two-a-days and you had to have some stamina? Yeah. You just got to keep plodding right on through it. How about, do you remember when we had rain and it just showed up? And what happened? We had to go clear across campus and go to the gym. We had to have adaptability. Nothing phases us. It's just another problem, another thing in our day that we have to overcome. So adaptability. So she gets hurt. It's not real nice if we just go up there and say, boy, that was a dumb move, right? Because then she's going to feel even worse. Empathy. I feel for you. I wish you would have missed that person, but it's all going to be all right. You're going to get back to health. You're going to be the greatest ball player that you ever could have been before that injury. Humor helps also. So this one over there that's laying there and she's got down on her back. You can say anything to her and she thinks it's funny. Okay? But a lot of times you can help settle the athlete down if don't go off with like a 10-minute story with a really poor punchline, but a little humor now and then can help. All right? Communication. And that's not just between you and your athlete, although that is important. That's also between you and that athlete's parent, you and your coach, working between the coach, the parent, and the athlete to where they all see the same thing. But at the same time, you got your doctor. So the stuff comes in from the doctor. We have to put it in layman's terms, put it to a coach in a football term, put it to a parent in a parent term, put it to an athlete in an athlete's term, so they all understand that they're on the same page, but meanwhile, we've talked 4 different languages. So communication is super. What about this? What if you're the head football coach and I wait until Thursday to tell you that, sorry, but your quarterback's really not coming along like we expected. You need to change your game plan. You would be upset. And don't think that they wouldn't either. Oh, they'd be blood pressure raising upset. Yeah, they'd get to yelling. So make sure you communicate how the progress is coming, not just with the athlete, but also with the coaches. Also with the parent. Don't let a parent be surprised that their kid's either sitting out or playing when they were expecting the opposite. Yeah, you're responsible for this stuff. Intellectual curiosity. Be curious about what is the next step in sports medicine. Right now, the next step that's out there is called blood flow restriction, where we restrict blood flow and then have them work out. Yeah, it's pretty cool stuff. So we're curious about it enough to where that's the conference we want to go to. All right? Be curious enough to know what's the cutting edge on the information about concussions or about ACL rehab. Everything will keep progressing. Don't stay stagnant sitting in the water. You're going to get covered in mosquitoes if you do. Ethical practice. I know this kid probably has a concussion, but he's like 10 times better even when he's got a concussion than what the second team kid is. And we need to win this. If we win this, we're in the playoffs. No. There are people that will do that. They will put a kid out there knowing that they shouldn't be, because they know that that kid better, even with a concussion, than what a kid is. Ethicals? Are you ethical when you're doing that? Absolutely not. Are you ethical by pushing a kid out too soon, out the door? Absolutely not. Wins and losses, they'll come and they'll go. But these people won't. So the athletes get mad when they're told they have to see the doctor. The athletes get mad when they're told they have to hold off a little bit. The parents sometimes get mad because it's the best thing for them, or maybe they're overzealous and they want that kid to play too. Very first year I got out, had a kid, his one leg was nice and healthy. His other leg, he got off of ACL surgery, and he had a 4-inch deficit in circumference in his muscles. And they're telling me, because the doctor said his ACL was fine, that this kid was fine. I said, no, he needs to go into the weight room. That parent and that athlete were both furious. So you have a team physician. Oh, we've got time. The team physician is technically who's over us as far as the eyes of the law. We work under some orders that are very vague but specific. Specifically vague. All right? It says we can use modalities. It doesn't necessarily say that we can only use therapeutic exercise. It doesn't only say that, but if a doctor wants to and he's not comfortable, he could be more specific. But our doctors trust us as far as what we do, and if we do a good job, it makes them look better. Makes them look like they were brilliant surgeons. So, the team physician is our supervisor and the advisor of the athletic trainer. He's, he compiles the medical history. You know, the medical history's got to be done before you get your physical here, right? They can't just do that and not know those major questions that cause them to say, you need to see somebody else, or you're cleared. So, evaluating the injuries, thus, and then diagnosing, especially at football games when they're here. They also can DQ a ball player. If I've sent somebody over to the doctors for a broken hand, now, that's too general. Is it a broken hand? Is it a boxer's fracture? Do they need surgery? Did they avulse up any tendons off of that? Back in the day, when I was young enough to a grasshopper, yeah, wee lad, it would be, your hand's broke. Go ahead and go play. Not necessarily so. We got time. What are y'all packing up for? I still got over 5 minutes. So they can DQ a kid for having too many concussions. DQ a kid for having a multitude of other things. So if the physician disqualifies someone, that's it. They're done. That disqualification may be for a game, for a week, for a year, or a lifetime. So it would be nice if they would attend practice, but you're not going to find them attending practice because, well, they're in surgery. They're in clinic. They have to make their living in order to take care of our folks. They do attend our games. They're at every home game. They also show up, our orthopedists will also show up if it's a close enough away game. And then they also show up to playoff games for football. They've got to make a commitment to the sport and to the athletes. And our guys do a great job making that commitment. Any day that we have an athlete that needs help, be seen by a physician, they will see them at either 8 a.m. or 1 p.m. All I have to do is text them. Text the doctor, can you see, are you in the office? Yes, I'm in the office. Please have them show up at 1. So if a kid gets hurt yesterday, they can be seen. That's better care than probably most colleges. Yes, it's pretty cool. So who are some of the other people that can help? School nurse. You know, our school nurse helps with the high blood pressure kids, right? Remember seeing that during physicals last year? They were too high, the school nurse would come them down. The EMTs that are on the sidelines, they help us by, if we need to have them transported, they'll transport to where we want, etc. The physical therapists who are over at TOSM taking care of our kids. They'll call us, make recommendations in the rehab program, and even rehab the kids if that's what their parents want them to do. The physician assistant, and both Dr. Hammett and Dr. Fall have PAs. So a lot of times we talk to them writing prescriptions as far as anti-inflammatories, coming to help with physicals, etc. A dentist is always good to have on your team because you never know when somebody might get hit in the face with a softball. All right? Social worker. Everybody who plays in athletics does not live in an ideal situation. And sometimes we see injuries that are not from athletics. And so we need to have a social worker who knows us so that we can call and say, you might want to take a home visit to Joey and find out what's going on there. I've seen a girl one time who used to get whipped with an extension cord. Not a very fun sight and not a very nice little wound. All right, a nutritionalist to help your athletes get the most out of their body. Find somebody who specializes in what goes in and how it gets burned. Something else, I mean, it's great for me to know the basics, but as somebody who is a specialist can certainly help us. All right, we'll get back into the history of the NATA tomorrow. All right.